AB 2010, the Spay Neuter Improvement for Pets Act, also known as the SNP Act, permits high-quality, high-volume spay and neuter to be performed in locations without separate surgical suites while maintaining California's high health and safety standards for veterinary surgery. California is in the midst of a multi-decade pet overpopulation crisis, which has only worsened since the pandemic. While there are many contributing factors to this crisis, the simple fact is that California's veterinary shortage has meant that the number of animals spayed and neutered every year has not kept up with the number of pets that need these services. This has led to severely overcrowded shelters, large numbers of stray and abandoned animals, and hundreds of thousands of healthy animals are euthanized every single year. The crisis is even more dire in rural regions like the Central Valley, where the nearest access to spay and neuter services may be an hour away and unaffordable to many disadvantaged communities. I've heard it directly from many of my communities that they need more help and support to address this crisis. Fortunately, high-quality, high-volume spay and neuter offers a pathway to address this growing crisis. Just a few weeks ago, I toured the City of Fresno's Animal Center, something I helped support when I was on the City Council, and saw Animal Balance in action, delivering high-quality, high-volume spay and neuter services. It was impressive, and it reinforced something we already know. We have solutions, we just need to scale them. The only issue was that the Fresno Animal Center is far away from these communities like Kalinga and Kerman and Mendota. So we need to make sure that these are more accessible and in the communities. So while a veterinarian using traditional spay and neuter techniques can help less than 10 animals a day, high quality, high volume practitioners can safely help many times that number, as surgeries are much quicker through the use of efficient workflows and the smallest incisions possible. I will tell you, I saw them and they were really, really efficient. However, regulatory barriers currently not only prevent high-quality, high-volume spay and neuter from being used to its maximum potential, but it prevents the use of mobile animal sterilization hospitals, or known as MASH clinics, which can bring those traveling high-quality, high-volume units to operate in the underserved and rural areas. AB 2010 addresses this issue by creating targeted exemptions for high-quality, high-volume spay and neuter from existing requirements for aseptic surgeries to be carried out in a dedicated surgical room free of shelving and with equipment for viewing radiographs. Exemptions from these standards will permit these MASH clinics to perform affordable pop-up, high-quality, high-volume spay and neuter events in communities with the greatest need while still meeting high standards of health and patient safety. Because in places like Fresno, Madera, and the high desert, and across the Central Valley, families often have to drive more than sometimes an hour to see a veterinarian. That's not access, that's a true barrier. My office has had productive conversations with the Veterinary Medical Board, and I'm committed to continuing to refine AB 2010 to provide the best possible implementation of our shared goal to increase access to affordable, high-quality, high-volume spay and neuter services. The SNP Act provides a much-needed fix to allow spay and neuter services at the scale needed to meet the public need.
Good morning, Chair Berman and members. Thank you so much for hearing this important bill today. Also, thank you to the Assembly BMP staff for your suggestions to make the bill better, and to Assemblymember Soria for tackling this very important barrier. The Veterinary Medical Association is very pleased that we are now thinking outside the box in trying to solve California's epic pet overpopulation problem, which has plagued our state for over 50 years. The veterinarians have played by the rules. We've done everything that we can do within our veterinary hospitals, but it's very evident that we need to get more aggressive with solving pet overpopulation. And the MASH-style clinics that Emma Clifford and her types of group provide are just that answer. It's remarkable to think that you can perform 30 to 40 surgeries in a day and successfully remove an organ from an animal in that volume, but that's exactly what they've mastered in doing. And we want to help clear the way to make that easier for the state of California. So the surgery room requirements that we're asking to be exempted from are very reasonable, and we do believe that these animals will remain safe. We've been shown through all of the research and data that they've collected from the hundreds of thousands of animals that have received the high-quality, high-volume spay neuter that these animals walk away from this procedure fine. They go on to live perfectly healthy lives. And so we believe that finding this compromise where we're removing very specific select surgery room requirements in order to facilitate this is a win for all. We're very excited about this bill. We believe it's a piece of a larger puzzle that we need to continue to put together to solve these problems that we've had. And we're very much appreciative of all of those who are willing to lend a hand. So we're asking that of you today and respectfully ask for your aye vote. Thank you.
Thank you.